Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Most people take at least one drug to manage disease and stay healthy. Drugs are expensive, and very often those same drugs can become unaffordable, even with insurance coverage. Today we will discuss ways to make your medicine more affordable, because no one should have to choose between food and life-saving drugs. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Stay tuned. Welcome back. The first step to affordable medications is making sure you have the right insurance. If you have Medicare, you likely know that there are several parts to put together to complete your Medicare coverage. One important part is Medicare Part D, which is prescription drug coverage. Joining us this morning is Kimmy Everman, Program Officer with the Montana State Office on Aging, to explain the prescription part of Medicare coverage. Thanks for joining us, Kimmy.
It's nice to be here. Thanks, Sarah.
So talk to us about SHIP. What is it?
Sure. Well, I was so lucky to be involved with the SHIP program for many years, and it's a no-cost network of highly trained individuals who help Medicare beneficiaries, their families. They help folks in the community who are caregivers to understand what comes with Part D. And I would add to your comment that affordable medication is the right insurance. It's also enough information to do the right thing, to get the right insurance. And that's what SHIPs are all about, is helping advocate for, helping teach or educate, not only beneficiaries, as I said, families, carers, etc., but just the general public. So often we hear from young adults that have parents with Medicare, and maybe that person is states away. So they love to talk to a SHIP counselor to kind of walk them through what it is all about. And it can be very complicated without some assistance.
So is SHIP available in Montana and Wyoming?
Yes, there is a SHIP in every single state and the territories. We've been around since the very early 90s when the Congress decided that they were going to make all of the Medigap coverages in line in terms of standardized. And so what I think is also extremely important about SHIP is that we're objective, or SHIPs are, counselors are objective. They're confidential. Nothing you say can be shared with someone else without your permission. They're independent, and that's huge. They don't answer to any insurance company. They're not supported by any insurance company. They're supported by the Administration on Community Living, which of course is in Washington, D.C., and especially in Montana. Each of our SHIP sites are paired up with our 10 area agencies on aging, and that's where those SHIP counselors work out of.
Is there a charge for this service?
Nope, there's really not, and that's what makes it honest and objective, I think, in a lot of ways, because we're getting nothing out of it tangible. We are helping folks who just need to understand a complicated issue. And the thing with Part D is it is complicated. There's so many. When I started working with SHIP and Part D, there were 50 or 60 plans available just that year alone. They've cut down, but it's still kind of overwhelming at times.
Well, I've worked with Medicare for a lot of years, and it is very confusing. So it's great to know that there are SHIP counselors available to help those that need it.
Right.
So talk to us about what Part D covers.
Okay. Part D is for medication coverage only, and very few things like injections and things like that. Those are not normally covered by your Part D, although there's 1 or 2 or 3. There, as I said, are many plans. They're set up in a structure that our friends at Centers for Medicare and Medicaid Services built, and they have to charge a deductible if they want. In 2019, it's going to be up to $415 annually, but that's only if they want to. They don't have to charge that. They also have a formulary, and a formulary is just a big list of medications that plan will cover and that plan will pay for. And with those 2 things, they start working with local drugstores, big box stores, to get their plans into those pharmacies so that people, according to Centers for Medicare and Medicaid Services, their goal is to have a pharmacy no more than 50 miles away from a person. Of course, they'd like it a lot less, and in many states they do, but in Montana, that makes sense.
So when can an individual enroll?
Well, an individual can enroll anytime they want. When they're just turning 65, they have 3 months before their birthday month, they have their birthday month, and 3 months after. Being the worrywart that I am, I always say do it quickly at the beginning, and then when your birthday month comes, that very first day, you're covered. One thing that many more folks are doing these days that are Medicare beneficiaries, though, is they're continuing to be employed, and they already have drug coverage. There's something you need to talk to a SHIP counselor about, because it might be that you don't need to buy Part D yet, but you want to make sure of it by talking to your HR or your benefits people at work.
When can I enroll? Sorry, I'm losing my voice.
Yeah. Well, we have a great enrollment coming up, and we're in it now, October 15th through December 7th, and that's really when we encourage everybody to come on out, see their SHIP counselor, and get the best information for the best plan for them.
Thanks for all the helpful information,
Sure.
Kimmy. In our next segment, we will hear more from Kimmy about the Big Sky RX program, and Jill Marie Steele, Executive Director of Pureview Health Center, will talk about a discount drug program offered through community health centers. We will pause here for a short break and have that conversation after these messages. Stay tuned. Welcome back. I'm your host, Sarah Medley, and we're joined by Kimmy Everman, Program Officer with the Montana State Office on Aging, to talk with us about the Big Sky RX program. We also have Jill Marie Steele, Executive Director of Pureview Health Center, to explain a drug discount program through community health centers. We will start off first with Big Sky RX.
Sure.
Thanks, Kimmy.
Sure.
What is it?
Well, one of the things I love best about the Big Sky RX program is it's homegrown, it's Montana grown. It became a program to help folks that are a little higher income with their Medicare Part D, and it's paid for, or it began to be paid for, by tobacco tax. It is another great thing about that program is that it's got an ongoing enrollment. So any time of the year you can enroll if you think you might, even if you don't think you're eligible, try. And that special enrollment can be very helpful sometimes. People may find themselves without a plan because they didn't know they needed it, or many other things can happen. And if they're eligible for Big Sky RX, they get an extra special enrollment period every year, and we can get them into a program that's going to work for them. And then Big Sky RX pays up to a certain amount each month. This year in 2018, it's $34 a month. If you want a prescription drug plan that's costs more than that, that's fine too. You pay the extra, but Big Sky RX will pay that $34.
How does someone qualify?
Well, you just have to be a resident of Montana most of the time. You know, we have the snowbirds, and it's important that your residence in Montana is more months than maybe if you go to Texas or Florida or something like that. You need to fill out an application. And you can go online to do that, to the Big Sky RX application, or call a SHIP counselor. They will help out. Another wonderful thing about the Big Sky RX program is that they don't look at your assets, say, as maybe Medicaid might. You can have houses or cars or boats or, you know, whatever that you have are assets, because we know, especially in Montana, that a lot of people are asset rich but cash poor. And so that's one great thing about the Big Sky RX program. That stuff doesn't count. It's just your income. And for a single, it's right around $18,000 a year. For a couple, it's right around $25,000 a year.
What if someone is outside that open enrollment period? What happens to them? Do they have to sign up at the same time that they sign up for Medicare Part D?
Well, that's what's so great about the ongoing enrollment with Big Sky RX, is that it doesn't matter when you call them and say, I'd like to try to see if I'm eligible. You can come in at any time that you want. So even if you don't think about it, you don't know about it, any of that, you can still look to see if you're eligible, fill out an application, and just call a SHIP counselor.
Are there programs like Big Sky RX in Wyoming for our Wyoming residents?
Well, you know, I'm sure that there is, although I don't. What Big Sky RX is called a state pharmaceutical assistance program. Most states do have those, and I don't know for sure, but I bet they do in Wyoming have something like that.
So there must be a website that if you live in another state,
yes,
you can go to a website and find out if they have a program.
Exactly, and I would always say, you know, look for that senior website or family services. They all name it differently, but every state's going to have a website.
Switching gears, we're going to talk to Jill Marie.
Hi.
Can you tell us about another way to save money on our prescription drugs?
Sure. Well, in Montana and Wyoming, there are community health centers. The community health centers came out of the Johnson administration's war on poverty. And so they are really geared toward providing services to people who otherwise wouldn't be able to have access to health care and prescription medications. The community health centers have what's called the 340B program, and that provides access to medications at a discounted rate.
Can anyone get health care services from a community health center?
Absolutely. There's a myth that you can only get access to health care at a community health center if you are low income or uninsured. But we see everyone. We see low income and high income. We bill all insurances. So anybody can access health care at a community health center.
And what type of services are offered through the community health center? So can you get your drugs at a community health center?
You can at most of them. They have a pharmacy. And if they don't have a pharmacy on site, you can ask them if they contract with any pharmacies for the 340B program, and they'll let you know where you can get prescriptions filled for that. But most community health centers do medical or primary care, dental, and behavioral health as well.
So in just a few seconds that we have remaining, can you tell us which community health centers are in Montana?
There are actually 17 community health centers in Montana. They're all across the state, and most of them also have satellite clinics in the rural areas.
So they can probably look online and find community health center near them.
Absolutely.
That's great. Thank you both so much.
Thank you.
Up next, how talking with your clinician and pharmacist could save you money. Stay with us. Glad you stayed with us. A colleague of mine now joins us, Lisa Sather, Mountain Pacific Quality House Director of Clinical Pharmacy Services. Lisa will take a deeper dive into the drug formularies discussed earlier, including ways you can save money on medications. Welcome, Lisa.
Hi, Sarah. Thank you.
Earlier in the show, Kimmy talked to us about formularies. What are they?
Yeah, that's a great question. So most Medicare plans providing prescription drug coverage have a tiering structure that really kind of outlines prescription drugs and their pricing. So it usually goes from your least expensive to your most expensive, and usually broken out into 4 or 5 tiers. So usually what you see are Tier 1 medicines are going to be your generic medicines. Tier 2, your non-preferred generic medicines. Tier 3, your preferred brand name medicines. Tier 4, your non-preferred brand medicines, and then getting into Tier 5, your most expensive are those specialty medicines. And sometimes, you know, a good example of those would be medicines for arthritis. The people will recognize that. So those are your most expensive medicines. And I think it's important to talk about, in order to get the most out of your prescription formulary, is to really know where your prescriptions fall in that formulary and ask questions of your provider. You know, most medicines anymore are available generically unless it's the newest, greatest medicine. And by mandate, generic medicines are as effective as brand name counterparts. So you really want to know if a generic is appropriate for you. You can typically get those for less expensive pricing. If your physician or doctor thinks that you need to have something that's in a more expensive tier, you know, visit with them. Sometimes you're able to get an exception to get it at a lower cost sharing if there's nothing else that is clinically appropriate available to you. And so that's just a conversation to have. And I think it's also important to talk about when you select a Part D plan, you really need to pay careful attention to where your medicines fall within the tiers of that specific Part D plan so you can know what your costs are going to look like.
Does your physician know about the formulary when prescribing medications?
Yeah, so unfortunately, no. That's a great question. Physicians see hundreds of patients per day, and in line with that, there are a different formulary for every prescription plan out there. So one idea is really to call your prescription plan and get a copy of the formulary that is your specific formulary, or go online. Oftentimes there are online websites you can sign in to, and bring that with you to your physician appointment so that you can discuss where the medicines you're taking are located in that, and come up with some ideas and find the least expensive alternative for you.
What if your physician doesn't have the time to review that formulary with you?
Yeah, that's a great question, because they're super busy. And so this is where you as the patient really need to engage in your health care. You can call your prescription plan, discuss with a customer service representative options, get a copy again, talk to your pharmacist. They're a great and valuable resource because they can help outline lesser expensive alternatives. Sometimes they'll even offer to call your physician and discuss.
Can your insurance plan change your plan's formulary?
Sure. As new drugs become available and new drug formulations become available, yes, you may see a formulary change. These new drugs and formulations are evaluated against the clinical evidence to see where they should fall into line. And so that oftentimes will happen. And another example is if a new generic comes out, or if we find out potentially that there's a safety or efficacy concern, or if the plan determines that a formulary change would benefit the plan in general, they may do that. But typically for Medicare plans, you're going to see at least a 60-day notice before a formulary change is made.
I've heard the term quantity limits.
Yes.
What does that refer to as it relates to a formulary?
Yeah, that's a great question. So most prescription plans will have a certain quantity of, say, dosage units that are allowed in a day supply or a month supply. So 1 per day would be a maximum of 30 for a 30-day supply. This is done based off of the clinical evidence and how the FDA has approved the medications. So that's really important, because obviously that goes to making sure that the medicines are being used safely and effectively for you. Sometimes exceptions are made outside of the maximum quantity limits based upon the clinical situation. So your plan, you can have your pharmacy or your doc talk with the plan to decide that. It's also very important to note some medicines for cost effectiveness, you'll have quantity limits because there might be a uniform pricing across each quantity, each strength of that medicine. So we want to use the least number of dosage units to get the best pricing. So that makes it more cost effective for the patient and the plan.
Preferred pharmacies is another term found in formularies. What does that mean?
Sure. So preferred pharmacies are a network of pharmacies that the prescription plan has negotiated with in order to provide discounts that are then passed along to the consumer. And it can save you money. If you go to an out-of-network pharmacy, you may end up having a higher copay if you use your ID card than if you went to an in-network pharmacy. So it's very important to pay close attention to that.
Can pharmacists help choose a lower price drug at the point of fill?
Yeah, that's also a great question. Yeah, they're kind of in a great position to do that. So it may not be accomplished right at that exact moment, but yes, if you fill your prescription, you're there at the pharmacy, and you realize it's going to cost hundreds of dollars, right at that point in time, have the conversation with your pharmacist and ask them if there's something that might be less expensive that would work for you. The other part of that is to make sure that you don't pay for your prescription and leave the pharmacy if you have a concern about cost, because once you leave the pharmacy, you're going to be stuck with it.
In the remaining seconds that we have, can you talk briefly about drug discount cards, good or bad?
Yeah, that's a great question. So drug discount cards often purport up to a 75% savings on prescription costs for you. Really, if you have a health plan, oftentimes that's going to be a better price for you because your insurer's already negotiated the discount. If you don't, you can have your pharmacist check and see if it's going to be a lesser cost for you, but it's just important to talk with your pharmacist about those options.
Thanks, Lisa, for that very valuable information.
Absolutely.
And thank you for tuning in today. I hope you found our show helpful. This is such a complicated topic. We hope to cover it further on future shows. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.